Michele is someone who understands the undiagnosed journey in a very deeply personal way. She is the director of support at UDNF, and she spent years searching for answers for her son, Mitchell. Their trip to UDN in Houston finally brought them some clarity. What researchers uncovered had since helped identify other children with what's known now as the Mitchell syndrome. And even after Mitchell's passing, the research he inspired continues to move forward and change lives for those children. And Michele brings that same heart and strength and commitment to every family she supports at UDNF. And we're truly grateful to have her with us here today. So please join me to welcome Michele.
Thank you very much. I appreciate the invitation. I know we've been on a journey to try and connect, and I was so glad when we connected recently, Caroline. So thank you for inviting me. Welcome to everyone here. As Caroline mentioned, I am the Director of Support at the Undiagnosed Diseases Network Foundation, and I'm going to use my time here today to share a little bit about the Undiagnosed Diseases Network, then the foundation, and then tell a little bit of my personal story as well. It would help me if you all wouldn't mind maybe doing a thumbs up or a hand clap or something that I could see on the screen if you are familiar with the Undiagnosed Diseases Network, the NIH research program. And if I don't see anything, then that will help me to know, okay, that will help me to know that, okay, Olivia, Rachel, familiar, Ed, I see your thumbs up. There you go. Ed's like, I'm just going to show you my thumb. I don't need to click a button. Okay, Caroline, thank you. Okay, that is helpful for me to know sorry, I need to get back in my presentation, but that's helpful for me to know that some of you are familiar. So just for those of you who are not, and for a refresher, so the Undiagnosed Diseases Network is an NIH-funded research program. It's been around just over 10 years. It is housed in the NIH, and basically about 15 years ago, the NIH created a program called the Undiagnosed Diseases Program. It was only in Bethesda, Maryland. If you had a super rare disease that nobody could figure out, you might be accepted to go to the Undiagnosed Program at the NIH. And it was a really amazing program, really doing some great science. And the director of that program and others felt like we should do this not just here in Maryland, right? This isn't fair to think that patients from all over the country should have to travel. I mean, it's a lot, especially for, complex medical situations to travel. What if we created more of a local experience based on what we've learned through the program here in Maryland? And so they launched the Undiagnosed Diseases Network, like I said, just over 10 years ago. And there are Undiagnosed Diseases Network sites around the country at many, many academic medical centers. Right now, it's about 20. And so that's the history of the program. And I'll tell you a little more about my personal link to them. But my son was a patient at the Undiagnosed Diseases Network back in 2017. And, built a relationship there, learned about it. And then in 2021, early 22, there was some in the patient and family community of people who had gone through the UDN. We started hearing that Congress was not planning on funding the UDN anymore. Or it really wasn't Congress. It was the actual NIH. The original Undiagnosed Diseases Network program was funded through the Common Fund, which is a fund at the NIH through the Office of Director. And Dr. Francis Collins was very instrumental in getting that started. But with the Common Fund at the NIH, you get funding for 10 years, and that's it. And we were made aware that the 10 years was coming up, and there was absolutely no plan at the NIH to continue funding this multi-million-dollar program that had been so influential in so many of our lives. So we kind of picked up this grassroots effort patients, families all over the country. We started reaching out to representatives, reaching out to, our Congress people, and saying, you've got to figure out a way to make the NIH find the money for this program. And so this is just one of those situations where I happen to really be in the right place at the right time. And the reason I have my little picture of Missouri, that's the state of Missouri, right smack in the middle of the country down there, is I live in St. Louis, and my son and all of his care was here in St. Louis. And at the time, the co-chair of the Senate Appropriations Committee, which is very influential when it comes to giving money to a budget to the NIH, to Health and Human Services, the co-chair was a senator named Roy Blunt, who was from Missouri. And so, like I said, it just happened to be that I was in the right place at the right time. Professionally, I was a nurse, and I was told that you need to reach out to, Senator Blunt's office. Tell him you're a nurse in the state and you want to know how they're going to help fund this program. And so I did. I sent an email. It's really all I did. I think that people think I went to some amazing lengths to do what I did. And the truth of the matter is I sent an email. And then they got that email. They were curious, and their team reached out to me. I didn't ever talk directly to the senator, but I talked to some of his staffers, told them about my son, shared our story, told the story of the UDN. They had no idea that the funding was ending. Senator Blunt had been instrumental in getting here in St. Louis, one of our universities, WashU, to be a site of the UDN. He did not know the funding was ending. And so they were, very dumbfounded that this program was going to just be ending and there was no plan. And so she said, okay, well, we're going to look into this. We're going to talk to the NIH. We're going to look into this. And come to find out, a few weeks later, I'm watching the Senate hearing live on C-SPAN or something. And this is in 2022. And Senator Blunt opens his opening remarks when they were talking to the director of the NIH, who at that time was an interim director. And in his opening remarks, he basically said, I want to read to you an email from a nurse in Missouri who emailed me about her son, Mitchell, and went on to explain the story about my son and basically ended it saying, and so, director, I want to know how you're going to find the money to fund this program. And, what I learned was that when Congress kind of says that to the director, their answer is, well, we're going to find the money. And ultimately they did. And a program that we thought was not going to be able to move forward, funding was found and it was able to continue. So I kind of share that long story just to tell you a little bit about the history of the UDN, but also to just point out that, you are powerful as a patient and a caregiver, and you have a powerful voice with Congress and with your legislators. And if you have an opportunity, take it. Even if you don't think, you're influential or anybody's going to listen to you, go ahead and take that opportunity. For me, it happened to be that where I lived, my occupation, my life circumstances happened to be exactly what needed to be in order for this senator to take notice. So there's that history there of losing its funding. And when that happened, the patients and families were like, whoa, we don't want this to happen again. What do we need to do? And kind of what they realized, and they did some focus groups. We had a lot of patients and families meeting that summer. And we felt like the UDN, the network as a whole, this amazing program, scientific program, solving the hardest of the hard cases. But there were some things missing. We needed, a kind of side-by-side organization, a nonprofit that was led by and for undiagnosed and ultra-rare patients, serving all of the patients in the UDN, as well as other undiagnosed and ultra-rare patients. And we knew that there needed to be an organization doing this. There was nothing. And so in 2023, on Rare Disease Day, we launched, and that's the day we got our nonprofit letter, was on Rare Disease Day. And the Undiagnosed Diseases Network Foundation was launched in 2023 with a board of a majority, either undiagnosed or ultra-rare patients. And at that time, a CEO and a director of operations, very, very bare bones. And that summer, I received an invitation to apply for a new position. They really wanted to focus on patient support. And they had received a grant from the Chan Zuckerberg Initiative to start a new program called patient navigation. And this was something that during the focus groups I had kind of pitched as this is something we need. If you're familiar with navigation in any way, shape, or form, you know that it's been out there in the medical world for decades. It started in the cancer world and really has kind of like grown there. And it's just supporting patients along the way through our very complicated healthcare system. And I said, when I was going through this with my son, no one was helping me navigate this. I mean, I really felt alone the entire time, despite being a nurse, in the academic field. I still felt completely alone, even, with amazingly supportive family and friends. And we needed to start this navigation program for the undiagnosed. And so the very first thing that the UDNF did was acquire this grant, a very large grant from the Chan Zuckerberg Initiative, with the specific focus starting a patient navigation program. And so I interviewed and was chosen to be the inaugural director of the patient navigation program. And, and this was a program that did not exist. It really took a lot of evidence from other disciplines like the cancer world. How did navigation work there, and how could I turn it to the undiagnosed community? What could we actually do to help? And, really the main things are just assisting by facilitating access to and coordination among services, and then providing education and support. Kind of, even if it's, I don't have an answer, I don't know what the genetic thing is that's causing your child's symptoms, I don't know, I don't have anything to do with the sciencey research, but I'm here to walk with you through this very long process, as many of you know. So we've built this program over the last couple of years. We've helped over 500 patients at this point have connected with us, adult patients, then adult caregivers of pediatric patients or adults who have caregivers. Our navigators come from a variety of backgrounds. We've had nurses, social workers, other parents or patients. Really kind of, we've been there. We know what you're going through. We're here to support you. I put this on here, how to reach a navigator, if any of you are interested. We have our UDNF webpage, so it's udnf.org. And you can go to Get Support, and there's a link for navigation. There's many ways to contact us. You can email us, support@udnf.org, or we have a phone number that's answered during the week. There's also voicemail if needed. But really, if you click on that blue button that says sign up for patient navigation services, within 3 to 4 days, one of our navigators will connect with you and just meet with you and find out how is it that we can help. And the main things we really are here to help with are connecting you to other undiagnosed patients and families, and I'll show you some examples of how we do that. Providing some insight into if you are interested in applying to the UDN. How does that work? What's the process? What has been our experience? So, really educating on that, educating about what the research study is that the UDN is. Sometimes we have connections to other specialists in other areas, and we might be able to give ideas that maybe you haven't thought of where to look for help. The UDN is not the only undiagnosed program. We can kind of inform you of other programs that are for the undiagnosed and connect you with other resources. I was really glad to see that you all are part of the Neurology Services Network with Child Neurology Foundation. They are a great organization, and we're also connected with them because one of the things we learned is when you're going through your diagnostic odyssey or the diagnostic journey, and that's not the only thing happening in your life, right? I mean, I think sometimes our doctors think that that's all we do is make appointments and are available to come to appointments and procedures and why is it so hard for you to get to this MRI? Well, because we have jobs and because I'm having this financial crisis, or I have a parent who I have to, go through their medical problems with. And so, life happens alongside the undiagnosed journey, and how can we support along that way? We have an undiagnosed resource guide on our website as well. It's also under that tab for Get Support. Some things you'll find there, we're kind of calling this our self-help area. if you don't necessarily want to meet with or talk to a navigator, we're trying to provide as many resources online as we can to help support and educate. We are building this page, but right now there's information on applying for and accessing the UDN, some community resources that we offer that I'll tell you a little bit more about. Then we have a great toolkit for preparing for medical appointments and organizing medical records. And we have some really great education on learning about genetic testing. So more to come on that page, but we really want to be able to offer support in a variety of formats, whether it's meeting one-on-one with a navigator. Absolutely. We can do a phone call, we can do a video meeting, or maybe it's linking you to our Undiagnosed resource guide, and on your own time, you can look at and see the resources that we've provided there. We want to just make it as accessible as we can to everyone. I will say, actually, before I move on, for meeting with a navigator, we do have a partnership with the interpreter service. So any language, really, I can connect with an interpreter who can do a video meeting or a phone call with us. So we are able to access ASL and other languages as well if we do have a patient navigation meeting. Some of the other community connections that we're really trying to build that you can find on our website include our community councils. And these councils are really based on our pillars at the UDNF. So we have fundraising, engagement, support, action, and innovation. These are open to patients, caregivers, clinicians, scientists, excuse me, people who want to volunteer their time to help the organization and also just help to build the community. They work on patient-driven initiatives that increase support and engagement in all of the undiagnosed community. They're open to everyone. Our Innovation Council just had their very first meeting in the last couple weeks. If you go to that QR code, you can see the schedule for all of the community council meetings, and you can sign up to attend one or more. I've been on a few of the meetings, and they're not just business, right? This is kind of business. Let's work on these initiatives, but they're also community. The teams are really getting to know each other, getting to learn each other's stories, and building a community based on shared experiences, but then also a shared passion for supporting the undiagnosed and the UDNF. The Undiagnosed Exchange is a brand new offering we just launched in February. This is a virtual support group led by two experienced facilitators who are also, one is undiagnosed and one has a rare condition. And professionally, they lead and facilitate groups like this and are volunteering their time. This first cohort is 8 sessions. They're meeting bi-weekly. We had about 16 people register. At every given meeting, there's probably anywhere between 6 and 9 people. This is something we're kind of learning as we go, is what times of day, what days of the week, what works better for people. Our current cohort is meeting on a weekday at 11 Eastern, and they're about halfway through. You can see the curriculum there. Every meeting is an hour, and they have a curriculum time, they have small group breakout time, they have just catch up with the group time, and there's an educational purpose and also connection purpose here. So we are planning on offering more cohorts in the future, and probably will vary the times just as we're kind of learning, but we're really excited about this and excited about the future iterations as we learn through this very first cohort. Now that I'm going to tell you about a couple events that are coming up, we have Undiagnosed Day on April 29th, as Caroline mentioned. You can use this QR code. We are hosting a virtual event. It's going to be about 4 hours with various speakers and breakout rooms, and we would love for all of you to attend. It is free, and it will be a great opportunity to learn more about what the UDNF is doing, what's happening in our community, and connect there. This event is coming up really soon, but I wanted to just make sure you were all aware of it, because who knows, some of you, may be able to get there. April 15th and 16th in Washington, D.C., we are having an in-person event where there will be meetings with legislators on the Hill, advocacy work, trying to really raise awareness of the undiagnosed and some policy issues related to that. So if you are able to attend and meet with those folks there, there'll be some community building, some education, and then the actual meetings on the Hill. Sarah at the UDNF, you can email her if you are interested and able to attend that. Finally, our Facebook page. We have our Undiagnosed and Ultra Rare Facebook group. This group is growing. This is a place where you can experience community, but also learn about what's happening in the UDNF. And a lot of resources are posted on there as well. So that group is growing. We have another group that is only for people who have actually gone through the Undiagnosed Diseases Network. If that is you, I'm happy to connect you to that group as well. But this group is for anyone in the undiagnosed and ultra rare community who, identify with being undiagnosed or ultra rare and are looking for a community online. I think that is all I have on UDNF and kind of what we've been doing. And now I want to share a little bit of my personal story and kind of how I got here and how I became so passionate for the undiagnosed and building our community. This is my son, Michele, as Caroline mentioned. He passed away in 2019 after a 6-year journey of not knowing what was happening. We live here in St. Louis, like I mentioned, and we have really great doctors here. And as all of you, I'm sure, have experienced, we went to multiple really great doctors and really great academic medical centers who just kept saying, we don't know. We don't know what's causing this. We don't know why he's having these symptoms. The best thing they could really tell us was, we think it's something genetic that we just have never discovered. We don't know about it yet. And so ultimately, we did enroll him in the Undiagnosed Diseases Network, and he went to the site at Baylor, and they did whole genome sequencing on him and my husband and I, and they found a variant in him that we did not have in a gene called ACOX1. And ultimately, they put his genetics into fruit fly model. Model organisms are amazingly cool how they can study new diseases using these organisms. So fruit flies was what they used to study Mitchell's disease. And they ultimately found that the fruit flies couldn't fly, the ones that had his same variant. And they ultimately decided that that was the cause. I love this picture. You can Google him if you Google Michele Herndon NBC. NBC News did a mini documentary about him and the UDN in 2019. And I kind of just love this screen capture that I got. If you can see the closed captioning of what he's saying, he says, "It has been very difficult for me to describe my disease to strangers." That just makes me laugh, and because all of you with an undiagnosed or ultra rare disease know exactly what he's saying. So just a kind of an update on the situation with Michele. Like I said, he first started having symptoms when he was 12. So it was like a 6-year journey. And as you can see here, I'm like consolidating many years into one slide. He was a normal kid, really didn't have other medical problems except a little bit of asthma until he was 12, when he started having difficulty walking, weakness, hearing loss, weird rashes. And ultimately, like I said, the diagnosis was made by the UDN in 2018. They had an idea for an investigational drug that was being used for something else, and his doctors made a valiant effort with the FDA to, apply for compassionate use, to get an IND and protocol in place. But he did have a quick decline when he was 19 and died without being able to trial the drug. In 2020, they did the very first publication about 3 patients. So Michele was the first one they found. Then they had a confirmation patient that they found in North Korea who had the exact same genetic mutation and similar symptoms. And then as they were working on writing those 2 up, they found the 3rd patient in the US. So in 2020 was the first publication. And as you may know, when it's kind of like Field of Dreams, if you remember that movie, if you build it, they will come. Well, I like to say, if you publish it, they will come. And that's what happened, is they published about these 3 patients, and slowly we started hearing about other patients around the world. My husband and I would get an email from one of the authors of the study saying, there's a new patient in Texas, there's a new patient here. And they started connecting them to my husband and I, just, for the purpose of connection. And so in 2021, my husband and I formally started the Mitchell and Friends Foundation to support patients with Mitchell syndrome and families. That was our original intent, was we just want to support them. We want them to know we're here. We built a website with information so that they could actually Google it and find information. But really quickly, we learned that support is great, but what these families were wanting was a treatment. And so in 2023, we started working with a lab here in WashU and raising money to develop a treatment called an ASO, or an antisense oligonucleotide. And they are still working on that. Takes many, many years of research, obviously, to get to a treatment. We are also working on a natural history study. We started recruiting for that in 2024, and we are hoping to publish sometime in the next few months. I'm on the team that's writing it, and we have about 25 patients now. So we have medical records that we've reviewed of 25 patients around the world with Mitchell syndrome, which is unbelievable to us. You know, if you'd asked us back in 2018 when Mitchell was the first person diagnosed, if we ever thought we'd know other families, have relationships with them, be helping find a treatment, I never would have thought that in any world. So this is our foundation website. You're more than welcome to check it out, the Mitchell and Friends Foundation. One of the things I love doing is connecting the families, just to know someone understands. And I get to meet with families when they come here for research. And you can see on the bottom left, this is actually one of our Mitchell syndrome patients. His name is Michael. He lives in Texas, and I was able to take him to the lab that has fruit flies with the Mitchell syndrome variant. So these are fruit flies that have the variant that he has. And it's a great experience for the patients to meet the researchers, but I think even better is for the researchers and the doctors to meet the patients and families and know what it is that they're working for. Many of them have told me that there are lab scientists who work on a disease their whole life and never really meet anybody with that disease. And so I love making those connections and just really, inspiring the patients that hope is out there. We are working on a treatment, and inspire the researchers as well as they continue to do amazing work. So I just want to say thank you. It's really been such a pleasure to be able to tell you a little bit about my story and share about Mitchell, but mostly to tell you about the Undiagnosed Diseases Network Foundation, the support we want to offer the community. We want to create a community that never really existed before. As you know, if you get diagnosed with something, you can kind of Google and find a support group or a website or, somewhere where you belong. And we never had that being undiagnosed. And we want to make sure that nobody else ever feels that way. And that's really the point of the UDNF, is just bringing our community together to have a place to belong. So thank you so much. And I would love if you had any questions. I'd be happy to share.